be learning about the Health and Information Portability and Accessibility Act of 1996, or commonly known as HIPAA. By the end of this training video, you will have a better understanding of HIPAA, why it is important and its impact on SUNY Plattsburgh operations, and your responsibilities on campus. Not to be confused with the hippopotamus, HIPAA is a far-reaching federal law pertaining to the privacy and security of healthcare information. HIPAA outlines what is protected health information and how it can be used, disclosed, and shared. Standardization of healthcare data, simplification of healthcare operations to help reduce costs, insurance portability to ensure continuing coverage of individuals who change jobs or become unemployed, preventing discrimination against applicants or businesses, and preventing fraud by providing stiffer penalties and tighter controls. First and foremost, HIPAA intends to empower individuals receiving healthcare services with a legal and enforceable right to see and receive the information in their medical and health records. Organizations such as hospitals, insurance companies, self-insured health plans, and small physician practices are considered covered entities under HIPAA. There are three categories of covered entities: healthcare plans, health providers, and clearinghouses. SUNY Plattsburgh in its entirety is not a covered entity. However, our campus operates departments and programs that provide healthcare service. Therefore, SUNY Plattsburgh is designated as a hybrid entity. A hybrid entity is a single legal entity whose business activities include both covered healthcare functions and non-covered functions, and that designates certain units as healthcare components. The following units are SUNY Plattsburgh's covered healthcare functions: Center for Neurobehavioral Health, Speech and Hearing Center, Student Health and Counseling Center. The following units, Athletics and Ward Hall Counseling Clinic, provide healthcare that do not transmit electronically and are not considered healthcare components as defined by HIPAA. However, the units will comply with HIPAA privacy and security rules and the HITAC Act as a means to protect service recipients' personally identifiable information. HIPAA protects information that qualifies as Protected Health Information, or PHI, essentially any part of an individual's medical record or payment history. Essentially, identifiable information accompanied by medical information is protected health information. In HIPAA terms, PHI contains medical information that concerns any past, present, or future physical or mental health of an individual, providing healthcare to an individual, or payment for healthcare of an individual. So, what is considered identifiable information? HIPAA established the following 18 identifiers. It's a rather exhaustive list. You may be asking yourself, would a person's initials be enough information to identify a person? Some practitioners would say yes, and although not explicitly listed, the use of any part of a person's name, including initials, is considered identifiable. PHI can exist in any medium: paperwork, electronic data, email, texts, and speech. And although all PHI is protected under HIPAA, there are separate but interrelated privacy and security rules regarding PHI. The privacy rule covers PHI in all forms, while the security rule covers only electronic PHI. So when are medical records not PHI? Because we're an institution of higher education and receive Title IV federal funding, records that are directly related to our students and maintained by our campus are protected under FERPA and therefore exempt from HIPAA. This includes medical information. Please note, medical records maintained by the campus as part of an employee's personnel file are confidential but are not considered PHI. Now let's chat about the privacy rule. It addresses the use and disclosure of PHI by covered entities. In general, a covered entity may use or disclose an individual's PHI only under these conditions: authorization or other legal agreement, treatment, payment, operations. Even though we are permitted to use and disclose an individual's PHI, we must make reasonable efforts to limit our use or disclosure as much as possible. Whenever possible, only the minimum information necessary should be shared. As a provider, you can use and disclose an individual's PHI for treatment. Therefore, the provision, coordination, or management of healthcare and related services among healthcare providers does not require a written authorization from the individual, nor is one required for consultation between healthcare providers regarding a patient or the referral of a patient from one healthcare provider to another. For example, in the Third Age Adult Center, a direct service provider can discuss an individual's services with the individual's case manager even if they are from another agency. Another use or disclosure that can occur without written authorization includes various activities to obtain payment or be reimbursed for services, to obtain or provide reimbursement for the provision of healthcare. In addition to the general definition, the privacy rule provides examples of common payment activities: determining eligibility or coverage under a plan and adjudicating claims, risk adjustments, billing and collection activities, reviewing healthcare services for medical necessity, coverage, justification of charges and the like, utilization review activities, and limited disclosures to consumer reporting agencies. And finally, a provider may use or disclose PHI for limited activities related to healthcare operations. HIPAA narrowly defines these activities. Our campus's healthcare operations include the following activities: conducting quality assessment and improvement activities, case management and care coordination, staffing reviews, business management, incident reporting, compliance activities such as billing, review, and audits. The privacy rule requires that covered entities use reasonable safeguards to protect the confidentiality of PHI. Reasonable safeguards include speaking softly when discussing PHI in public spaces, such as at your desk or in a hallway, not using the name of the individual whose PHI is being discussed, reminding employees to keep PHI secure at their workstations and in public spaces, isolating and locking filing cabinets or anything else that contains PHI, logging off your computer when you walk away from your desk, and equipping computers with password-protected screensavers. Another element of the privacy rule involves sharing our privacy practices with the individuals we serve. As part of our intake process, we must provide our campuses Notice of Privacy Practices, or NPP. You can access our NPP at any time by visiting the site listed below. The NPP must be provided at the time of intake and every 3 years. Additionally, it must be provided when requested and posted on our website. We must also retain copies of the issued notice and make a good faith attempt to obtain an individual's written acknowledgement of receiving the NPP. Business associates generally may not use or disclose PHI in a manner that is inconsistent with a covered entity's NPP. Although HIPAA is a federal law, if state laws are more restrictive, then it preempts HIPAA rules. For a complete listing of New York State preemptions, visit the site listed below. Some highlights include: patients must see their information within 10 days. Providers can deny access to personal notes and observations. Providers can prevent release of certain information that one practitioner obtains from another, and information disclosed by others to the practitioner on the condition of confidentiality. If a parent requests information concerning a child over 12 years old, the practitioner may notify the child, and if the child objects to disclosure, may deny the request. Now, onto the HIPAA Security Rule. HIPAA Security Rule addresses the creation, receipt, maintenance, and transmission of electronic PHI. This rule applies equally to covered entities and business associates. The primary goals of the Security Rule are to maintain the confidentiality of stored and transmitted electronic PHI, to protect electronic PHI from unauthorized creation, modification, and deletion, and to ensure that electronic PHI is available to authorized individuals or entities when needed. The Security Rule sets out 3 types of security safeguards required for compliance: administrative, physical, and technical. The Security Rule includes these administrative safeguards. Security Officer. Designating a security officer to be responsible for the development and implementation of security policies. Our campus security officer is Holly Heller-Ross. Workforce Security. Developing a plan for granting employees varying levels of access to PHI. Contingency Plan. Developing a plan for responding to system emergencies and natural disasters. Business Associate Contracts. Having contracts with business associates to protect the confidentiality of PHI we exchange with them. Termination Procedures. Implementing procedures to prevent a terminated employee from having access to confidential information. The Security Rule requires that we protect PHI from fire and environmental hazards, as well as from intrusion. Physical safeguards include facility access controls, developing procedures that allow authorized access to places where PHI is kept but that deter intruders. Workstation use, developing procedures to handle PHI that is or may be displayed on computer screens. Workstation security, providing secured rooms, curtains, partitions, or user IDs and passwords for workstations on which PHI is processed. Device and media controls, having procedures for the handling of computer hardware and software such as laptops, PDAs, cell phones, disks, and tapes, including proper disposal and storage. The Security Rule also requires that we implement certain technical safeguards for electronic PHI, including access controls, limiting access to PHI on a need-to-know basis based on roles and context. Audio controls, recording and examining system activity to eliminate unnecessary access to PHI. Person or entity authentication, using verification controls such as passwords, PIN numbers, biometrics, or tokens to ensure that those seeking access to PHI actually have authorization. Transmission security, protecting PHI during transmission over electronic networks, including encryption and protections such as firewalls, SSL, TLS protocol, and S/MIME support. The Security Rule distinguishes between secure and unsecure PHI. Let's take a look at PHI in different mediums. We have shredded, recycled, and waste paper, and email. Which of the following do you think meets the Security Rule's definition of secure? you guessed none of these options, then you are correct. The shredded, recycled and waste paper are large enough that it could be read, and our campus Gmail accounts are not encrypted. So, what would secure PHI look like? Secure PHI is information that is protected by a technology or methodology specified by the government, the Health and Human Services Department, or HHS. It must be rendered unusable, unreadable, or indecipherable to unauthorized persons, or shredded or destroyed so that it cannot be read or reconstructed. The paper particles seen here are an example of paper that has been destroyed in a secure manner. Encrypted electronic files, including email, are also secure. Please remember, a password is not synonymous with encryption. Examples of a security breach include the theft or loss of an unencrypted electronic device containing ePHI or any other circumstance when the use or disclosure of PHI is made to an unauthorized person. If you become aware of a security breach, please report it to your supervisor or the HIPAA privacy officer immediately. If there is a security breach involving unsecured PHI, notice must be given to the affected individuals, and if the breach affects 500 or more individuals, to the government and the media. In January 2013, the HHS Office of Civil Rights, OCR, published a final omnibus rule implementing HIPAA and the Health Information Technology for Economic and Clinical Health Act, HITECH. The rule expanded patients' rights, introduced new safeguards to protect medical information handled by covered entities, and strengthened enforcement tools. In addition to what already has been discussed, individuals have these rights over the use and disclosure of their PHI. Covered entities must abide by an individual's request not to divulge PHI with his or her health plan for payment or healthcare operations if he or she is paying for the full service cost to which the PHI relates. Individuals are entitled to copies of any records that the covered entity keeps electronically. Individuals have the right to request that the covered entity correct any inaccurate PHI. Covered entities maintaining electronic health records must provide an accounting of all PHI disclosures made for treatment, payment, and healthcare operations during the prior 3 years upon the individual's request. Fundraisers must notify individuals of their right to opt out of any future fundraising solicitations, and covered entities may not condition treatment on any decision concerning the receipt of fundraising information. As a general rule, HIPAA prohibits covered entities from disclosing PHI to others for marketing purposes without the patient's written authorization. For example, the Speech and Hearing Center may not provide a hearing aid company a list of patients with a particular condition in order for the company to market devices to those patients without their authorization. At the same time, we do not need written authorization to communicate with an individual to provide reminders or other communications about hearing aid devices currently prescribed. Likewise, we do not need an authorization for face-to-face communications or for other communications that promote health in a general manner. For example, distributing a pamphlet or newsletter to patients to inform them about new healthcare developments would not be prohibited by HIPAA. Our campus, like many covered entities, uses the services of other individuals and businesses that help us carry out our healthcare activities and functions. These so-called business associates include auditors, consultants, lawyers, claim processing firms, pharmacy benefit managers, and the like. The HITECH Act outlined that business associates must comply with HIPAA. If your role involves the procurement of services and contracts, you will learn more about business associates in our campus Business Associates training video. Now that we know about HIPAA's privacy and security rules, let's discuss why it is important. SUNY Plattsburgh has established a reputation of high-quality services. Part of that reputation is the expectation of confidentiality and security. Now, if that is not incentive enough to maintain the privacy and security of PHI, then perhaps the penalties of non-compliance. Failure to comply with HIPAA can lead to significant financial and other penalties, such as the following. Civil fines range from $100 to $50,000 for each violation for up to $1.5 million per year. Criminal penalties for a basic offense may include a fine of up to $50,000 and/or imprisonment for up to 1 year. Criminal penalties for an offense committed under false pretenses may include a fine of up to $100,000 and/or imprisonment for up to 5 years. Criminal penalties for an offense committed with the intent to use PHI for one's commercial advantage may include a fine of up to $250,000 and/or imprisonment for up to 10 years. How does HIPAA affect you and your responsibilities in a covered unit? Primarily, the impact will be on the creation, sharing, and retention of PHI. For example, if the individual is a SUNY Plattsburgh student, FERPA prevails. If creating ePHI, please ensure that the files are secure. This can be achieved by only using workstations on the campus's secure HIPAA VLAN or approved cloud-based software. When sharing an individual's information, do not use campus email, but rather follow your department's procedure for sharing service recipients' information. For example, your unit may require that individual records can only be faxed. When discussing an individual's information face-to-face or over the phone, it is expected that providers will be mindful of their surroundings to ensure confidentiality. Record retention is based on SUNY Records Retention Schedule and the General Records Retention Schedule. Holding on to records longer than necessary can be problematic, as can the premature or unsecure destruction of records. Please ensure that individual records remain on campus and are secured. In line with those safeguards, please follow the following guidelines when handling PHI. Access PHI only to the extent necessary to perform job-related functions. If it isn't related to your job-related functions, then do not access it. Obtain written authorization whenever using PHI for marketing purposes. Destroy PHI per the retention schedule and in a secure manner. Always double-check the recipient's contact information before transmitting PHI in any medium, whether by fax, phone, or secure messaging. Contact your department privacy officers. They are Athletic Training, Jason Pactor. Center for Neurobehavioral Health, Michael Morales. Speech and Hearing Center, Ashley Gambino. Student Health and Counseling Center, Laura Rosenbrock. Ward Hall Counseling Clinic, Portia Turco. Or contact our campus HIPAA officer, Annika Fulham, or email hipaaprivacy@plattsburgh.edu.